Now we would discuss the sixth nerve palsy. So before I discuss the sixth nerve palsy, remember the sixth nerve, the lateral rectus is at the nucleus is at the level of pons. I forgot to tell you about the fourth nerve nucleus. So remember here, please write it in your notes that the fourth nerve nucleus is at the level of inferior colliculus. I already told you that the third nerve nucleus is at the level of superior colliculus. Okay, so these can be your questions in your exams. And as you all know, the superior rectus the sixth nerve supplies the lateral rectus. Okay, so whenever there is a sixth nerve palsy, the damage would be in the lateral rectus. The patient would come with a paralytic squint. Now, the lateral rectus is not basically acting. What is acting is the third nerve and the superior oblique. So what the third nerve can do is that third nerve basically can cause a medial movement of the eye, a medial squint of the eye. So there can be in the long standing cases esotropia. Okay, like I told you, there can be a exo in the third nerve palsy. So opposite to that, in the sixth nerve palsy, there can be the eso. The mechanism would be same. The unrestricted action of the third nerve muscles would cause a bit of eso in these cases. Also, as this is the paralytic squint, so all the features of a paralytic squint, like a diplopia, like a past pointing, would be here, and the secondary image, the second image that is formed in these patients would be further far away from the image that is the real image. Okay, so the past pointing would be further far away from the real image. So these are some important clinical features of a sixth nerve palsy. Now you would see a sixth nerve palsy 9-gaze photo like this. So this is a patient. Now you can see in this patient, this eye is not moving laterally. Okay, so all other actions are there, but this is not moving laterally. So this is my lateral rectus palsy. So these 9 gazes and the various gazes, the head tilt. So whenever they talk about the head tilt, think about your superior oblique. Whenever you see that the eye is not moving laterally, think about the sixth nerve palsy. Whenever you are seeing ptosis, think about the third nerve palsy. And also remember that in the lateral rectus palsy, there would be a past pointing, and the past pointing would be like this, that the image would be formed further away from the image that is already there. So these are some important points that you should remember regarding a lateral rectus palsy.